All right. Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. I'm Amanda, and of course, I am joined by my wonderful co host, Olivia. And we are joined today by Dr. KarenAnn Gordon, but we get to call her Karen on the show today. So, Karen, thank you so much for being here with us today.
Thank you
Um,
for having me.
I am so excited to hear this conversation and hear your story. So, I want to just kind of start. Tell us about your journey into dental hygiene. Where did it all start for you?
Oh, it's such a long one. Um, it's interesting and weird. I
Those are the
started my
best.
yeah, I started my journey when I broke my front teeth at age 10, 9, 10.
Oh,
And
man.
it was very traumatic, but at the same time, it was an interesting experience. Um, for a very long time, I wasn't very happy with like my smile, and then over time, when I had to go to like braces, I'm like, wow, this is really cool. When I went to get like crowns done and just all the different things they were doing and how hands-on it was, I'm like, wow, I really like this. Meanwhile, I was already in school for like something else, like actuarial science. Like, how boring is that, right? And I'm like, this isn't for me. I'd rather do teeth stuff. And without even knowing it, when I was like maybe about 10, since the trauma, I started like collecting teeth, saving teeth. So I had like a little jar, so disgusting and gross. I'm like, every time
I
I
have
lost teeth,
stories. I have
I'd put it
stories.
into, I'd put it into like a little medicine thing, and I'd have like Listerine in it, and have all my little teeth in there. It was like sick. So yeah, so I had that for a long time. So
This
that was
podcast
my.
is taking a dark turn. I didn't see
Oh,
this coming.
well, it's the truth. That's what I had. So that's my little stuff there that I was like kind of obsessed with, and then um, going through the whole process of going through braces and the whole seeing the endodontist, the pediatric dentist, seeing the dentist very often. I really began to like it, not really knowing that's the path I need to take. So then I migrated here to the US and I went to do some more research and I fell into hygiene. And that's how my dental career started.
Very cool.
Fascinating.
I hope that jar is gone.
Oh, it's still gone. I had it till I was like 20. So it was kind of gross. Yeah.
I
And
okay. I collected teeth when I was in practice at first, like special teeth, like where I don't know, something specific, but I would sterilize them. Does that give me points of like not gross?
maybe.
Just
Um,
a little. Okay, you have no room to judge here, Karen.
no, no, I'm not judging. I was a weird kid. I had a whole bunch of teeth just chilling out on my dresser.
Yeah. No.
So
Yeah.
you mentioned you immigrated from to the United States. Where are you from?
I'm originally from Jamaica.
Oh, beautiful. I love Jamaica. I got to do a mission trip in Jamaica just last year. It was such a great time.
I think when I was stalking you, I saw that. Yeah.
I think we could almost safely say, where has Olivia not been?
Oh,
And that
I
would
come on.
be like
know,
a
right? Every
safer
time she
bet.
posts something really nice and interesting, like, ooh, I want to go there.
I
So I live
know.
vicariously through your travels.
Oh, thank you so much. I'm having fun for all of us.
Thank
So
you.
we want to talk more about your account, the Chirohygienist. So you are both a chiropractor and a dental hygienist. So can you talk
Yes.
to us about what you share on your social media account? What kind of content can we find there?
Sure. First I started up with a lot of TMJ content, which is cool. The information is still there. Um, I was like completely obsessed because like so many people have untreated TMJ pain, and I felt like this is something I need to talk about, right? So at first I started out as a TMJ therapist, which is cool, I thought it was catchy. But then as I begin to grow from, or should I say mesh the two, I changed my name to the chirohygienist because that's who I am, a chiropractor and a dental hygienist. And I felt like that kind of is who I am. So some time to time I'll talk about different things related to hygiene, the practice of hygiene, and the stuff related to the practice of chiropractic, but really it's about the human body, how we experience things, how different things affect um, different parts of our body, how the mouth affects uh, really the whole oral systemic health link, how, musculature will affect how, we chew, how we eat, even how we walk affects our jaw. So like everything is really interconnected. You can't really think of us as separate systems. So as I began to evolve, I kind of my page is evolving. I haven't been really active lately, but my page is evolving. As it's evolving, I'm looking at the body as a whole, as opposed to just separate little parts.
I feel like insurance needs to understand that. Like, why in the world do they have so much authority to dissect the body into different categories when it's not the case? I know that's a whole
It's
other
sad.
subject that we could go into
Oh,
and
I
all
could
vent
talk about
about.
that. I
Oh,
could talk about that.
I'm
But yes,
sure. I'm sure.
it's bad. It's bad because it shouldn't use insurance to dictate health,
Mhm.
right?
100%.
So, I used to tell my patients in practice, I said, I don't care what your insurance pays. Sorry. This
Yeah.
is what you need, and this is what we're gonna recommend, and then you make the choice that's best for you. So you figure it out. If your health is more important, then you're gonna know that's what you're gonna focus on. If that's not what's important, then you make those choices as you go along.
Yeah. No, absolutely. So I'm curious, how long did you practice as a hygienist before you became a chiropractor?
I would say so. I've been in chiropractic for the last 7 years, and I've
Okay.
been a hygienist for, yeah, you could call it 20 years. You can call 20 years. Yeah.
Okay. So 20
So
years hygiene and then chiro, or
so 13. So I've never stopped doing hygiene. So I'm
right?
still a practicing hygienist. So I would say about 13, 14 years as a hygienist, and then the last 6 years or so, I practice chiropractic.
Okay.
So now what motivates you? You're a doctor, you're a professor, you teach continuing education courses. What motivates you to stay working in the app as a hygienist?
Because why not, right? When you work in the operatory as a dental hygienist, you get to see things differently. Like I like
Mhm.
where hygiene is going. We're not like stuck anymore, right? We have now realized that we need to do things differently. We need to look at people from oral systemic, then we have to be, we're looking at the type of techniques that we're using. We're looking at the instruments we're using, ergonomics. I mean, why not? I learned so much more interest, not more. I would say it's more of like an add-on, more interesting things as time goes by because things never stay the same. I feel like that's a good way for me to keep grounded on what's going on in hygiene world. Like I don't want to not be involved in hygiene world. Like I don't think of chiropractic and hygiene different. Like sometimes I'm even tempted to tell my patient, well, you need to come and see your chiropractor when your neck's so stiff, you check your jaw. which I have done, and I have to like control myself. Like, look, today I'm the hygienist. If they need to see me, then they can see me elsewhere, or I'd refer them to someone else for any kind of neuromuscular treatment because I try to separate myself that way. So it's tempting. So I have to try and figure out which role am I in today. Okay, so it just depends.
Mhm. It
Yeah.
seems like you love dental hygiene, and that's a beautiful thing. Being in a community of hygienists who love taking care of our patients, who love to keep pushing the profession forward so that we can keep delivering the best care. So it's really refreshing to hear that you're still got your pulse, your hands on the pulse of what's going on in the hygiene world.
And I think you described it exactly who I am. Like I need to know what's going on so I can help my colleagues. That's why I do CE credits. That's why I do teaching. That's why I talk to people, not because I have nothing to do. It's it's really just because, the more educated you are about how integrated everything really is, the better you are at educating your patients, taking care of yourself, and not burning out, right? That's
Yeah.
because that's what's bottom line. You get to enjoy your job.
Mhm.
I think it's a sad statement where there's so many hygienists like you. If you're in the hygiene space on Instagram, burnout is such a big topic and a big deal, and so many hygienists that are just like desperate to get out of clinic or trying to leave clinic, and they're just like, how can I get out of this? And it's like, it's sad because there's so much joy and fulfillment in clinic.
Mm-hmm.
That it's, I mean, I still practice 4 days a week. I enjoy clinic. Like I enjoy my coworkers, so that makes it much, much easier to still enjoy my office and my experience at work. But it's sad and it's alarming to see how many hygienists, like fresh out of school, are just like, hate it, I want out. And I mean, that's discouraging to see.
It is very discouraging because part of the issue is, we need to not lie to people when they're in school. Be very realistic about time management, you know, do a real world simulation so they really do have an idea of what it is like in practice. Everybody knows that they spent 4 hours with one patient in hygiene school. That's unrealistic, right?
Mhm.
We need to be moving at the pace of what's really out there. So if we're in almost about to graduate and we're still working at a 4 hour pace, that means you're not really ready for the real world. So when you go out into the real world, it's like culture shock. This is not what you anticipated it to be. I didn't anticipate to be seeing 10, 15 patients, 30 patients a minute. I'm not saying that's the best care. I'm just saying that might be some offices that you choose to work at. And the reason why people are burning out against choices that they make, right? You said, Amanda, you have like almost, it sounds like a unicorn office. I know, Olivia, I'm like always like, ooh, Olivia, what are you doing next? Right? But it really boils down to the choices that you make. Where do you
Mhm.
want to work at? And sometimes it's good to temp before you actually take on a job, so you can see, get your skills ready, get your timing ready, see how it feels to be out into a clinic environment. And it's sad that we are losing hygienists day by day. I think COVID started this snowball effect of
Yeah.
hygienists that are capable of leaving the field. And that's partly the reason why I still work. Like the dentist I work for, she can't find a full-time hygienist that is capable and wants to stay. Sometimes she does find someone and they're unreasonable, or they just it just doesn't make sense for her financially because they're struggling too.
Yeah.
Um, I just feel like we need to be more honest in the school environment about what's going on in the real world. And we also need to be honest with ourselves when we go out into practice and we're starting to look at these offices. Maybe we need to temp a little bit first. I remember when I left hygiene school, there wasn't really a lot of temp agencies. There are just a few. You're lucky if you got into this particular one and they started to feed you work. But now we have tons of different options,
Mhm.
and you really don't necessarily have to even work full time. So it just depends on what you're looking for and having to realize that, you know what, this is what really reality is, and sometimes you have to suck it up.
Mhm.
Unfortunately, I'm gonna keep it real. Sometimes you have to suck it up, and that's how you're gonna learn if you're always complaining.
No,
Mhm.
I appreciate your dose of truth. I say this a little bit in jest, but I also say this with an element of truth. I feel like as a prerequisite to getting into hygiene school, you should have some sort of background in either working in fast food or retail to deal with
Seriously,
people. Thank you, of like just
seriously,
people. Because
yeah,
if you've
yeah.
never dealt with people, then that can be such a hard element because that is not something that you learn in school. I mean, maybe the patients that you get are great, but so much of the time it's going to be your friends, your family. Like
Mm-hmm.
maybe you'll get somebody thrown at you that you don't know, but like people skills. It's
Mhm.
a hard one to learn. And
I,
yeah.
I literally teach a class for where we teach like scenarios where we try to get students to do the interview. In the first interview they do when they meet the patient, right? People make an assumption or judgment of you the first time they meet you. So if you're not, you know, personable, you don't have that affable quality, they're not going to want to generate, uh, gravitate towards you.
Yeah.
So people skills is something that kind of like a lost art because we're so I always
Digital.
thought that, yeah, I always thought that hygienists had that special power. Like we literally could talk anyone while we're cleaning their teeth. Like that is a special skill. I would get so much information out of someone in 45 minutes, and then it's like, how do you know that? Oh, I've been cleaning your teeth. And, you have your ways that you do it, right?
Yeah.
And it helps you to formulate that relationship. How are you gonna know that they have three kids, a dog, and probably two cats, and they're going to China next month or something. Like you ask them all those questions, and you talk to them to keep them calm, and you develop a relationship. So it's the art of people skills, I think, is kind of dwindling away because it becomes so virtual, and people are awkward now, you
Mhm.
know.
Mhm. It's true. So before we transition out of this topic of chiropractic care, I really want to hear from you more about when you're evaluating a patient that has any disorders associated with their TMJ joint. What's kind of like your step-by-step process to see what you can do to help the patient and basically what hygienists can imitate from you tomorrow in the operatory?
Sure. So the first thing that we learn when we are in hygiene school, even in any practitioner, is the health history. We have to do a nice investigative research as to why is it that this person has this problem, right? So the health history is going to help us to guide us. Is this probably the problem induced by medication? Is it habitual? Is it psychological? Right? So those are the things that we look at. And then other things that I would suggest that we look at is then evaluating the tissue, having them open and close, see if we hear any popping or crepitus or clicking, look at the jaw deviation, measure it. There are several different tools out there. Now that my functional therapy is more mainstream, which I really love, that can help us with evaluation. Another thing that I think is great that you can take home tomorrow and use is using an outcome assessment tool. I'm extremely big on proving that something is happening, right? So if we're able to take pictures, we are forward thinkers. We will take pictures, everything. When the patient's in the operatory, we use our digital cameras. We look at we take a CBCT, assess the jaw joint. Also, when you're doing your muscular assessment, using the look at how much deviation they have, lateral excursion, protrusion. Those are the things that we look at. And of course, understanding the musculature. Now, I'm not telling you to become a massage therapist. I'm just, if we can recognize that there is a problem, then we know who they need to be referred to. Looking at their occlusion, looking at their curve of spee, also looking to see if they have any crowding, any overjet, underbite. Is there anything that we can they be referred out to ortho? Can this possibly be an ortho issue? Do they need to see a TMJ specialist, a dentist that actually does TMJ work? Do they need to see a chiropractor that specializes in that, right? Not just any chiro, someone that actually specializes in that. And then we have to look at their behavioral habits because their behavioral habits are a big driver for the problem. If someone's a nail biter or they like to chew on things or they're constantly clenching and grinding their teeth, those are the things we also have to correct. So even if we fix or change or address, say, the jaw joint issue, we really haven't really solved the problem. We have to go down to the root cause of the problem. Some patients, you may want to have them work with a manual therapist, like a chiropractor, a physical therapist, or a facial myofunctional therapist, or even a speech therapist to help them to figure out musculoskeletally what's going on with them. So something that they would take away, some simple steps. One, health history, physical exam, and then of course, diagnostic imaging.
Wonderful.
I'm curious, what does practice look like for you? Like, how many days a week are you practicing hygiene versus as a chiropractor? Like, what does that look like?
So hygiene, I only practice once per week
Okay.
because I'm very my whole schedule is filled up with chiropractic because I teach chiropractic.
Okay.
So at the college where I'm teaching, that's my whole life. So I'm constantly challenging students to think about their patient, incorporating what I learned from dentistry into the art of chiropractic, and also, you know, teaching them how to definitely manage patients. So those are the things that I have to, I do on a day-to-day basis. So 4 days a week, I'm doing my thing. 4 to 5 days a week, I'm teaching. And 1 day a week, I actually work in practice. I only work part-time in practice because I don't have that much, I'm tired.
Yeah,
But
I would imagine so.
but I work 1 day a week, and it's really because I really value the relationship with my doctor. She's great. Some people are like, why didn't you work with her full time? That's because I wanted to do different things. I needed to do different things so I could learn different things. I could be helpful in other ways.
Mhm.
I
That's
love
so
that
cool.
perspective.
Yeah. So now we know many hygienists have musculoskeletal problems. Our
Ooh.
ergonomics are not the best. Maybe we're not we're not doing the best in taking care of ourselves. So if a hygienist is having back pain, how do they know if they should pursue chiropractic care, physical therapy, massage? Like, how do we know what to do?
I was waiting for this question.
Yeah.
Okay. So
Everybody
really and
else probably
truly,
is too.
yeah, really and truly, we should all be going to the massage therapist. We should all be going, we shouldn't be looking for pain as a reason to go and get self-care.
Mm.
Going to the chiropractor is self-care. Going to a physical therapist if you have a slight issue is self-care. Going to the massage therapist is self-care because that's what we lack. We lack taking care of ourselves. Why? Because we take care of everyone else, right? We know everybody's problems. We keep it to ourselves. And the thing is, when we keep, um, you know, I was telling a student the other day, when you're treating people manually, we treat people manually. We do arts therapy with instruments. With as a chiropractor, you do therapy with your hands. Same thing. You take a lot. If you're an empath or you're very emotionally invested in your patient, that begins to weigh down on you, and then you become stressed. So the best thing for you to do and the same thing happens to a hygienist. When you're talking to somebody, you take all that on. You need to release that. So even if it's not going to the chiropractor for your low back pain, exercise is great. I can't stress enough how much um, motion is lotion. It is what helps to keep your um, body moving. It helps to keep your back in check. It helps to prevent the problems that are going on. So sometimes you go to your chiropractor, they'll actually put you in an exercise program. Same thing with their PT. Even when you see a massage therapist, they put you on an exercise program so that you can build strength. So I highly recommend exercise. Look at your diet. If you're eating bonbons and I don't know, you know, fried
Cereal.
chicken and cereal
Cereal.
and not drinking any water, right? You're not drinking water, you're not taking breaks, bathroom breaks, you're not taking breaks in between patients, then you're gonna have a problem. That's what the back pain comes from. If you have what we call the biopsychosocial component of pain. If you have lots of stress in your life, then it does what happens to you. It turns into inflammation, and that inflammation actually causes pain. There's a chemical process that occurs that causes pain. So if you're not managing your stress, you're not sleeping well, not eating well, then you really need to do a self-assessment and then figure out what do I need to address, right? Um, as per back pain, there are many different things that we can do. Look at your ergonomics. If you're in a little tiny cramped room and you can't move around your patient and you're stuck in the same exact position, that's a problem. You need to be able to move around your patient. Wherever your hand is going, that's where your body should be going, right? And that's how I was trained. Your hand, your arms, Stephanie Botts. So everyone knows Stephanie Botts, right? Stephanie always talking about chicken wing. Girl, she know what she's talking about. You need to make sure your arm is closest to your body. Use your loops. I stopped using loops because I had difficulty with my eyes. That's a whole different other story, but that's just personally me. I can't wear loops. I wear my glasses instead. Um, Again, if you invest in the right type of tools, then you won't have problems using a saddle stool. I'm a big proponent for using the right type of saddle stool, making sure that you're wearing the right shoes when you're working. Even the clothes that you wear, if your uniform is too tight, you're not able to really move around your patient. And think about, and this is something that we don't really talk about, your workflow, your working distance from everything else. Where is the stuff that you're using as opposed to what's on your table, the brightness of the light, all these things. Can I really see what I'm looking at? I feel a vision. Can I actually see what I'm working on? Are my instruments sharp? Am I there doing everything the hard way, scaling every single solitary tooth with dull instruments, or not using the Cavatron tip as I should, or not investing in equipment that will make my life easier? So those are the things that we look at in order to decrease back pain. Simple things that we can do is try to make sure that we keep our weight in, well, I shouldn't talk about weight, but but it's a touchy one. But we have to work on our bodies. If we're not being physically active, walking around, moving around, taking breaks as we need to. I suggest every 20 minutes you look away. If you're still working also, just look away, stop, take a break, look, take your eyes off, you're using loops. Just stop, just take a break, stop, look away, stretch, readjust your body, and then go back to work. This way, your muscles won't fatigue out. Your back begins to hurt when you begin to fatigue. You're holding that same position for 45 minutes to an hour. Who even decided that we need to work straight for 45 minutes? Who decided that? Like, I don't know who came up with that concept. Why do you need to sit there for whole hours? So my suggestion is to any hygienist that's out there that's experiencing back pain, look at your workstation, look at your workspace, take into consideration, you know, if it's not weekly, bi-weekly, monthly, some self-care. If it means going to the massage therapist, going to your chiropractor, talking to your nutritionist, working with a trainer, something to get your joints and body moving, that's what you need to do. And then make sure that you take definitely your nutrition and stress management into account. Because if you're stressed out, then you're always going to be like in pain.
I go to a massage therapist that is like the official massage therapist for the professional or semi-pro soccer team here in Salt Lake City. And he knows I'm a hygienist. I've been going to him for a little while now, and he is like a magician. Like, his knowledge of muscles is mind-blowing. But I always kind of ask him, like, oh, like, are athletes the absolute best? Are they in the best physical condition? And he's like, no, they are professional compensators. And he's like, hygienists, you guys are so horrible at this too. Like, you are just as bad. You compensate with the worst ergonomics. So he has said some things that you absolutely just hit the nail on the head with. Of, we don't pay attention to our workflow. I think I've noticed a huge difference. I've been doing assisted hygiene for a year now. It makes such a difference.
Unicorn office.
Love it. I love it.
I think that should be a thing. We are our own. We are providers. We control our schedule. We make money for the dentist. Mark, in some states, they are their own. They can practice by themselves. I did assisted hygiene once in my life. It was beautiful.
You're not as tired. You're not as tired.
And then, I do my scaling, or she would take my X-rays. I'd prep to go in real quick and do my SRP. If I had a SRP case and she was doing a prophy and she had calculus, she'd call me over and stop, do what I need to do, and then she finishes up. She'll help me clean my room, get everything going. And then we were able to work a really productive schedule in her assisted hygiene. Again, that boils down to the practice that you work for. If they don't understand that we can run our own schedules and we can be extremely productive, then they won't get it.
Yeah. In my practice, we've been doing assisted hygiene for a few years now, and our production went through the roof, because now you have time. If you need to do laser or Curodont or periprotect trays or whitening, you have somebody to back you up, and you're able to manage both patients. So I think if hygienists are forward thinking, they don't mind learning new procedures, they don't mind thinking about the numbers, and you have a willing and competent dental assistant, it's the best way that hygienists don't get burnt out and the patients get better care. And it's fair to the dental assistant if they can focus on that and not be expected to do that plus work with the dentist. Then it becomes overwhelming for them as well. So it's a beautiful model. Hopefully more offices will get into it.
It's less stressful too. I think it does decrease your stress if you have a good assistant. My amazing assistant left me a few months ago or weeks ago. Devastating. And I got a new assistant, and it's been a little rocky, but she's getting there. And so I feel much better. But there was a solid week and a half that it was a very stressful time at work.
Oh, definitely. I mean, you know what one dentist told me, because she was so impressed, she had no clue. She's a periodontist. She said, you're like a mini dentist. I'm like, duh. We literally know everything that you know. I mean, to the not necessarily every single thing,
right?
But we have a very good understanding of what's going on, right? And because we have a very good understanding of what's going on, typically the information that we give our patients, or even the home care or the management, we're spot on, right? And you know, if the dentist values us the same way and they understand that we are actually just as valuable in the practice, then it'll be easier for them. Production will be up, we'll be happier, the staff will be happier, the patients will be happier. Patient satisfaction will go through the roof, because now you don't have patients waiting for a very long time, or they don't feel like they've been rushed through, or you weren't thorough enough, right?
Yeah,
definitely. Agreed. So Karen, I want to learn more about your teaching continuing education courses, and especially coming from a professor. Can you talk to us a little bit about how you got into teaching CE, and if there's another hygienist who's interested in teaching a course, how they can take their idea to actually developing a course?
Sure. When it comes to teaching a course, I usually just look, what's okay, all right, I'm gonna sound cliche, but I actually look at TikTok and Instagram and see, put your mask on. It's in your room. I'm sorry.
No, I was like, put your mask on. I was like, I haven't heard this advice. Where is she going with this?
Sorry, I was just talking to my 11-year-old.
She just seamlessly was in mom mode.
It happens. But when it comes to continuing education classes, I use what's trending. What are people talking about? Like, nobody wants to hear something that's not interesting, right? So you want to talk about things that people want to know, and sometimes you have to be innovative. Think about all the connections, or something that you see in practice that you keep on seeing happening or coming in front of you in the chair. I started talking about TMJ because I kept seeing it as a problem as it came into my chair, right? I also saw lots of people coming in with occlusal issues, right? So it just depends on what it is, and whatever you're good at, whatever you like. I feel like if you talk about what you like, then it's really easy. If you believe in something, that's the thing you talk about. If you're really good at something, talk about that thing. You don't have to always be remaking the wheel. The remaking the wheel is the hard part. Now, I'm weird. I like making little weird connections. So I'll like try and make a connection with TMJ to your toe, right? Because that's what I do, right? I'm trying to mesh the things that I love together and see how I can connect them. Now, to get into the space, working with a speaking coach is great. A mentor is great. I teach, so I speak every single day. So speaking to an audience is okay. Um, Even going on Instagram and just talking to people, or going on a live, or just interviewing with people, or doing a podcast like we're doing right here, that's a way for you to actually get your ideas out there, because someone else wants to hear what you have to say, right? Also, I feel like uh, when it comes to coming up with something different and new, sometimes you can remake somebody else's idea. I'm sorry I said it. But if you see something that you think you could do better, do it. It's okay. This is a free world, right? If you think you can improve upon it, or there's certain things that you think you'd like to talk about, then just do it. I don't think if you do it scared, then you'll never do it. Well, at least you're doing it. If you never did it, then you just never did it. Just do it, and you'll
Yeah.
find that these opportunities will come along for you. Just keep speaking and meeting people and talking to different people, and that opportunity will literally come. A good platform that I've worked on is RDH Connect. With RDH Connect, different people are looking on your platform. I believe LinkedIn is a great way for you to put yourself out there using social media, just talking to people, being receptive, even just randomly sending a message. Talk to someone that you want to mentor you. That could be a way for you to kind of get into um, making CEs, talking to CEs. I'm sorry, talking about CEs, even the magazines that we read. Sometimes in the back of the hygiene magazines, they're looking for speakers, right? They're looking for new articles that they can use to put the information out there, new ideas, new concepts. So that's why I keep my ear on the hygiene floor, because I want to hear what else is going on out there.
Those are interesting tips. I can't say I've looked in the back of the magazines, but
Yeah,
that's,
I mean,
yeah.
sometimes you're flipping through or you're on Facebook, you'll see like a particular website thing is look call for abstracts. They're looking for speakers, or do you have an article idea that they want you to write? Even writing your own blog, you can make your own stuff. Why depend on somebody else? Just write about it.
That's right. You can make your own podcast. We'll just do it.
That's right. Mhm.
Yeah, so that's some really solid advice, not to be scared to put ourselves out there and just start and figure it out along the way. But there's room for everybody, so it's really good advice. So now, if a hygienist does move forward with speaking and they're teaching their first course, what tips can you give them to be confident and engaging with their audience?
I feel like
Ooh.
Olivia is asking this question on my behalf. So thank you, Olivia. I appreciate it. Let me take
We're
notes.
getting a free master class, Amanda.
I'm like,
Well,
tell me.
honestly speaking, just be yourself. You know what we're really good at? Being positive, smiling, being personable. That's who you have to be. Just do it. Be like Nike. Just do it. Smile. Um, you know, uh, think of your audience. The first time I did, I was like really scared. But sometimes being scared is good because that that little scaredness propels you to try and do better. And that's what I use. I use that little bit of fear, that little bit of anxiety, and then it becomes easier the more often that you do it. Plus, I think when you're trying to get out there, find someone that you want to be like. Find a mentor, someone that you like, that will talk to you, give you advice. Me. Just and when you're out there, just be confident. You talk to people every day. You meet people you've never talked to before every single day. Think of the audience just like your patients. Think of how you want to depart that information so that you can convince them that they need to switch to the latest electric toothbrush as opposed to brushing and scrubbing with something they got from the dollar store that says hard on it, right? So think about your whys, and I think that will propel you forward. The public speaking part, I won't say it's easy. I always get butterflies. I think to be nervous is normal, and because I'm always thinking, are they even listening to me? And something that I've learned recently is to read the crowd. I'm always like trying to move, looking at the crowd. I look at one person all the time, then I go back and look at somebody else on a different section, somebody else. And that helps me to not focus on how many people are actually there. Right. And then I crack jokes on myself because that's my personality. I make fun of myself as I'm talking, and I feel like it makes me relax because then I'm more relaxed. And know your material. I'm not gonna say I'm perfect. Sometimes I fumble on even my own material. I'm like, oh my God, what did I even write? But knowing your own material, I think makes it easier because then you can naturally speak about it with even, you'll know what's on the PowerPoint, and then you just start talking about the facts that are there without even having to really read what's on there.
Yeah, we're looking forward to Amanda's course. She's got some courses coming up soon, and we're so excited to see her on that big
More
stage.
power. I love it. I love it. I
Thank
love
you.
it.
Positive
Yes.
vibes.
Yes. Actually, did you see the study? If you think positively, you live longer. So there you go.
Yes. Yes.
Mhm.
Positive psychology.
Mhm.
So now, Karen, you were already a hygienist, a married woman, mother, but you went back to school to become a doctor. Now you're a professor and you're a hygienist and you're teaching courses. So how can you manage doing all this stuff, staying happy, staying balanced, staying positive? What tips can you give people who want to juggle a lot of hats?
I've been waiting for this question all night. The truth is, it's not easy. I'm not very organized, and it's crazy. If I don't have family support, then I can't do any of this. So my family is a big supporter for me. If they don't support me, then it makes it hard. So my husband's awesome. He's always supporting everything I do. From he's been with me we've been together for 24 years, and we've been married for 19 years, and um he has literally gone with me every 5 years. I don't know. Every 5 years I went to school, right? It's bad. So I know next year, 2025, I'm due to go back to school again, but I'm not going back to school. I'm done.
I was gonna ask, like, what's
No,
next? Clearly, you
just
say that.
no,
You
no
say
more, no
that.
more. But family, if I didn't have my family to support me throughout the whole entire um, process, then I couldn't do it all. Practical things that can help definitely is try and stay organized. I'm not a very organized person. Don't let my husband hear that because he'll be shouting in the background if you heard that. But it's true. I'm not the most organized person. It's bad, but in my brain, I know what needs to happen, right? I know things that I need to achieve in my head. Something that I've been using to help me is to put it on paper and to put it on a digital format so I can keep things organized. And then some things you realize you just have to let go of. So as you are growing professionally and you're prioritizing your mental space and your health, you can't do everything. For me, the most important is family. Let me stop. God first, then family, then everything else. Now, I love to teach. And because I really like teaching, I want to stay in the teaching space. I want to really stay in academia. I feel like I get better at it as time goes by. That was always my dream. I'm there now. I'm going to stick to it. And the ways that I can help my community is by doing CE courses, teaching different things, whatever I come up with in my brain. But in order for me to stay organized with it, I have to prioritize what's most important. If I don't do that, then I'll have like a whole bunch of jumbled things and then I can't achieve or stay on task. So to help me stay on task, I use a digital planner. I use a paper planner, write in my phone. I use my calendar. Um, I try to do things very simple as possible. I don't like complex mechanisms and systems. And when I become overwhelmed, then if you're a mom, you already know about being like overstimulated, right? And I don't want to be overstimulated because then I'm not my best me. So, for example, as I transition into my next role as hygiene educator at Risewell, didn't know about that one, huh?
Welcome to the team. I am also a
Yay!
Risewell educator.
That's right. I know. There you go. See, my girls are here. So, as I take on this next role, I have to step back from clinically. I can't do as much clinic hours because now I'll be talking to people about learning about the wonderful benefits of hydroxyapatite. So, that's that's what I have to be doing, prioritizing. So even when you go into practice, and you see things on your schedule that are going to create a problem for you, you have to prioritize, is this worth my sanity? Am I going to be able to do 15 prophies in 8 hours? That's too much. Can I really give good quality care? So again, prioritizing your well-being, health, mental health, um, creating boundaries, figuring out what works, what doesn't work. I think that's how I'm able to do what I have to do, because otherwise I'm on that case.
Mm-hmm. I
I
love that advice to be simple.
Yes. Keep it
So-
simple, stupid.
when I decided, okay, I want to start speaking, like I got the speaking bug. I got a mentor, Julie Kagan, most wonderful lady on the planet. And she kind of was honest, and she was like, if you are going to add something into your life, you need to figure out what you're going to take out of it. And
Yep.
that is not my personality. That is my toxic trait. I'm like, no, there's
You should
room in
see my
there for
closet.
more.
My toxic trait. So even in my life, that's part of what I need to work on, is as I bring new things in, I have to take the old things out. It's because we're sentimental, and we value the
Traditions.
worth and tradition, and even something old and tattered. Well, this used to be blah blah. Nobody cares. And then when I realized that, what, this has passed its useful life. Take it out. I need to declutter. I need to declutter my brain, my space, my time. Because what's the one thing that we can never get back?
Time.
Time. We'll never get back time. So we have to think of it as a precious commodity and use it to the best way possible. If we're gonna be wasting our time on things that are not gonna bring us joy, throw it out, get rid of it, and move on.
Mm-hmm. Very good advice.
Yes.
All right, Karen. So we want to know our last two signature questions. If you could go back and give yourself advice as a new grad hygienist, what advice would you give yourself?
Ooh. As a new grad, you can't blame or think about school. They should have taught me this or should have taught me that. Be confident. Know your worth, right? And don't burn bridges. No, I won't say I haven't never burnt bridges. I have. I've gone to some spaces where it was just toxic. I'm like, you know what? Peace be with you. you know? Um, but at the same time, don't burn bridges, because even though we don't think about it, the hygiene and dental space is a small space. It's not not as big as we thought it really is. It's very interconnected. You're gonna meet people doing the same things, meeting the same people, having the similar experiences. So, you know, be confident in what you know. I think that's important to any new grad in any program, anything that they're doing. You are taught well. Be confident in that information, and roll with the punches. Be flexible.
Great advice. Very good. I like that, not to blame, oh, I should have been taught this in school, but kind of take that responsibility yourself and say, okay, well, let me go learn it now.
Exactly.
Realistically, there's only so much time in the hygiene program, and we always need to be lifelong learners to be a great hygienist. So that's really good advice.
And that came to me as I'm teaching. I'm like, there's no way I can teach all this stuff. I'm like, what I tell my students? I say, you better go Google that. Look it up. Go research it. Find an article. I said, this is only the skeleton. You have to put the rest on it.
Yeah, very good. All right, and our last question for you, Karen. If you can go back and think about something, what's something that took you way too long to figure out in your career as a hygienist that you wish you figured out sooner?
Oh my God, is this a cry sash? Is it really a cry sash?
It can be.
Whatever you want it to be.
Honestly, something that I would have done earlier is take care of my body. Take care of myself. Um, that's why our profession is suffering. I think at the moment it's a great time for hygienists, but it's also a bad time for hygienists at the same time. And we have not been taking. Why are we waiting till lunch to pee? Why? Why aren't we drinking enough water? Why is our body hurting? You know, why are we frustrated with our schedule? You know, why don't we have a boss that treats us with respect? So those things come down to, I mean, if I could go back in time and fix things, is take care of myself, prioritize myself. I actually know so many people that have, you know, even including myself, end up with kidney issues just because I didn't pee on time or drink enough water or not eating right, you know, scarfing down my food just because I want to go back and take care of my patients instead of thinking about how can I properly manage my time so that I can take care of my patients and still make the production needed. Um, you know, we were talking about assisted hygiene, just really taking care of your body because you only have one body.
Yeah.
Yes, we can buy joints, but they're not the same because you know they're we can buy them. You know, we can add things in, take them out, but they're not. If we don't take care of it early in our career, then it's going to harm us later on. So many hygienists leave the hygiene because they'll end up with um, kind of repetitive stress syndrome. They end up with carpal tunnel. They'll end up with this crazy old man scary hump. You know, it's kind of scary. They'll end up with cervical problems. They'll end up with lumbar problems, knee, joint, hip. You know what I mean? Just because they didn't understand that in order for, if you're going to take from your body, you have to give back to your body, right? Every time that we're scaling someone's teeth or taking care of a patient, we're using a lot of force. We're using a lot of our body in order to take care of this patient. So if we're not providing our bodies with food, with sustenance, with relaxation, with happiness, then we're just slowly deteriorating our body. So the one advice, the one thing I would focus a little bit better on throughout my whole career is definitely taking better care of my body.
Karen, I was thinking about this idea earlier of I've been a hygienist 17 years. And when I first started practicing, if I had pain, whether it be a headache, period cramps, or if I was sick, I felt like the expectation in the field was pop a pill, put your big girl panties on, and get to work. And
Unfortunately, yes.
it
Yes.
was. It
Yes.
was. And today, right before lunch, I had a patient and my doctor was in the middle of 2 surgical extractions. I was starving. Like I was really hungry. And he was 15 minutes into my lunch. And I had let him know I was ready for an exam like 20 minutes ago. And I mean, I obviously want him to take his time and do a phenomenal extraction. Like I don't want him to rush. So I went up to the front and told my office manager, "Can you do my exam? I'm hungry." And she's like, "Yeah, no problem." So I went and left and went to lunch. And I came home and I was like, if this was me 10 years ago, I would still be at lunch suffering through.
Exactly.
And
Exactly. Drawing
that's,
our boundaries. We
yep,
have to be able to pull that boundary and
yeah.
you know what? I remember when I was this is the one corporate job I had for a very long time, which I really like. I won't tell you where I worked at. Starts with an A, that's all I say. But I really, really liked that my job, and I was in the middle of lunch. Now, the golden rule is if I'm at lunch, don't dare ever come talk to me about a patient. I do not care. Don't ask me. I do not know. My brain and body has been turned off. I had to learn how to develop boundaries. You know, boundaries are, you know, things that we will and will not compromise on. And my lunchtime is precious to me. You know how many people go in their car and cry at lunchtime? So, I mean, I don't want to be that person. I want to chill out wherever I want to chill out. And if I'm in the lunch or in the break room, I'm chilling, watching TikTok. Please don't come talk to me. Um, I am at lunch. And I had a manager do that to me once, and I had to put him in his place. I said, when I am clocked out at this facility, it is my time. If you're required to speak to me, please wait until I'm back on the clock and you have your time and you can address me to the patient. And I wrote it up in that email. Oh, guys, if any hygienist is listening out there, please, please have your receipts. Put everything in writing. Stop taking things at face value. You had a conversation. Oh, let me follow up this with an email. My name is Karen, remember? Okay, I'm going to follow that up with an email because I will have the receipt 3,000 years ago to show you that you said XYZ when we talked about it because this is what we talked about. So, I mean, follow things up with an email, make sure everyone is aware of what's going on. And sometimes you have to set that boundary, honestly.
Yeah. And you know what? Boundaries can be set in a very kind way. I think many people are scared to set boundaries because they feel like they have to be mean to say it, but it doesn't even have to be like that. And it can
No,
be, you can preserve your health and preserve your professionalism and good relationships
of
by just
course.
letting people know how you feel. So very good advice, Karen. It was such a pleasure hearing from you
Ah,
and getting to
same
know
here,
you
same
more.
here. It's like I know you guys because I silently stalk you all.
Thank you so much.
Yes, thank you guys for having me. I am extremely happy to be here today.